My name is Rafe McMahon and I would like to talk to you today about Cauda Equina syndrome. Cauda Equina is one type of spinal injury, and Cauda Equina means horse's tail in Latin. It is the name for the collection of nerves in the vertebral column below what is known as the conus medullaris. Crucially, it lacks the protection of the spinal column, and that is absolutely crucial. Cauda Equina syndrome, or CES, as it often is known, occurs when the nerve roots of the Cauda Equina are compressed and they disrupt the motory and sensory function to the lower extremities and even the bladder. Patients with this syndrome are often admitted to the hospital as a medical emergency. CES can lead to incontinence of urine or bowel and even permanent paralysis. The causes of Cauda Equina, or at least the most common causes, are as follows. A severe ruptured disc in the lumbar area, and this is the most common cause. The narrowing of the spinal cord, or what is otherwise known as stenosis in the medical world. A spinal lesion or malignant tumour. A spinal infection, inflammation, hemorrhage or fracture. A complication from a severe lumbar spinal injury, such as a car crash, a fall, a gunshot or a stabbing, more common than you would perhaps think. If you have CES, you will need urgent treatment to relieve the pressure on those nerves. Surgery must be carried out expeditiously, and this is in an attempt to prevent permanent damage. That permanent damage could be paralysis of the legs or partial paralysis. Patients with back pain should be aware of the following red flag symptoms, and these may indicate CES. These red flag symptoms might be the following: severe low back pain, motor weakness, sensory loss, or pain in one and more commonly both legs. Saddle anesthesia, where one is unable to feel anything in the body areas that sit on the saddle, is another red flag syndrome or symptom. If you have CES, you will need urgent treatment to relieve the pressure on the nerves. Surgery must be carried out expeditiously in an attempt to prevent permanent damage, such as paralysis of the legs or partial paralysis. Loss of bladder and bowel control can also be an ongoing problem with CES patients. Sexual functions or other problems can also arise. You may need medication to reduce swelling or an infection. If the cause is a tumour, you may need radiotherapy or indeed surgery. You can seek help from an occupational therapist, a social worker, a continence advisor or a physiotherapist. Cauda Equina may also be a hotbed for litigation. GPs and very often young doctors often miss the signs, the red flags I've mentioned above, and do not direct immediate surgery, believing the problem is just a bad back or a slipped disc that can be treated by simple physiotherapy. They then discharge them, and this is where the problems arise. Lawyers will engage experts to show that the Cauda Equina should have been diagnosed, and if it had been diagnosed, that damage would not have occurred at all, or at least not as much. Any case that the person has may then be quantified. If you have suffered from Cauda Equina and there was not an immediate diagnosis, you should contact your lawyer. He or she can advise you from there. Should you have any queries, please contact me, Rafe McMahon. I'm a partner at McMahon Golding Solicitors, contactable on 01677 0044. Our offices are based in the centre of town on Grafton Street. Thank you for watching.